This is my audience today. Most people hear cancer and they just think of one thing. But cancer is not just one disease. It has many different types and it has many different speeds. Like some grow really fast, some grow really slow. So, for example, diffuse large B-cell lymphoma. Now, let's call this DLBCL for short, okay? It grows really fast, and according to National Cancer Institute, it's the most common form of non-Hodgkin lymphoma. And throughout this speech, I'm going to break down what exactly DLBCL is, how it's diagnosed, and how it's treated. So, let's start with looking at what it is. So, DLBCL is blood cancer. It starts in the B cells, and those are your white blood cells, which are supposed to fight infection. But as cancer is introduced to them, they start to grow out of control. Now, when this happens, they're not really able to do what their normal function is. So, they start growing tumors. Now, this is usually going to happen in your neck, armpit, and groin. So, how does it reach? It reaches because your lymphatic system is connected to your immune system, which really leads to those areas. And the Lymphoma Research Institute explains that DLBCL is aggressive. Now, this means that it grows fast. And that's why early diagnosis is so important. Now, you may ask, well, I know what it is. How do I know if I have it? DLBCL has several symptoms. It has swollen lymph nodes, night sweats, fever, unexplained weight loss, and fatigue. It's very similar to other illnesses in this aspect, which is why your symptoms aren't the only way that you're supposed to diagnose it. So, you have your biopsies. Now, this is where you take a small sample of tissue from a lymph node and you check it for cancer cells. So, this will tell you if you have it or not. But it's not going to show you exactly how far the cancer has spread, which that's why you need CT scans and PET scans. Because it also shows you kind of approximately how long you really had it. So, you know what it is, you know how it's diagnosed, well, how is it treated? DLBCL, according to the American Cancer Society, R-CHOP is a combination of chemotherapy drugs, immunotherapy, and steroids. The goal is to destroy cancer cells and stop the growth completely, but unfortunately that's not always what happens. Sometimes you just kind of can't stop it at all, and the best that you can do is just slow the process. And while patients do respond well to R-CHOP, that's not the only form of treatment. There's radiation therapy, stem cell transplant, or just other things for cancer in general, with basic chemotherapy being the most common. So, what I want your key takeaways to be for this is DLBCL is a fast-growing blood cancer that's identified through symptoms, biopsies, and scans. And it's treated with R-CHOP, which is chemoimmune therapy. So, you know, I've talked about what is DLBCL, and I've talked about really just the information involved in it. But the reason why I'm here to talk about this today is because of my dad, Scott Adkisson. I really love him, and it's been a really hard journey since we found out about this. And sorry, my voice is cracking. But I really just wanted to, even if it's to my own family who knows about it and to my teacher, I wanted to spread awareness about DLBCL as best as I could. So that's why I talked to you about DLBCL here today. Thank you.